The number of deaths from COVID-19 in NHS hospitals continues to be very high, but the most recent figures do seem to offer some hope. 12,868 people diagnosed with COVID-19 have now died in UK hospitals, an increase of 761 on the previous figure. This was the smallest percentage increase since the start of the outbreak, and it means that for the first time, deaths are expected to take more than a week, now 8 days, to double. Some scientists say this might mean the epidemic has peaked in the UK, but even if it has, we are still likely to see hundreds of deaths reported each day for some time yet. Some breaking news to bring you now, and Sky News understands the government is set to launch a formal review into why people from a black and ethnic minority background appear to be disproportionately affected by COVID-19. Sky's Inzamam Rashid joins me now. This is something we've been talking a lot about over recent days, Inzi. What would this review entail?
Well, Sarah, look, the government has come under some scrutiny over the past couple of weeks, ever since an early report was released into the number of black and minority ethnic people in critical care units up and down the country. There was a call from the chief of the British Medical Association to the government to investigate into why specifically frontline NHS and social care staff were under the cosh, essentially, and were the victims of COVID-19, and those from a BAME background. Now, it's my understanding that the government will now carry out a review. They'll launch a formal review in the coming days. The Department for Health and Social Care will lead on it, along with some other bodies who will also help them as well. It's my understanding that there was a meeting yesterday led by the Department of Health and Social Care where they outlined the details of what exactly they need to entail in this review, but they will specifically be looking at why black and minority ethnic people in the community and frontline healthcare and social care staff have been affected by COVID-19. Now, in some analysis done by Sky News, we've seen that out of the 54 frontline health and social care staff who have sadly died from coronavirus, 70% of them come from a black and minority ethnic background. A huge percentage of number of from a BAME background coming from the NHS, frontline NHS staff and social care staff who have sadly died from coronavirus. Our analysis has actually, Sarah, also found that 4 out of 5 of the health trusts in England, which have actually recorded the most deaths so far, cover areas with some of the highest black and South Asian populations. Many of these were in London and in West Midlands, which together actually account for almost half of all the deaths in England. There's a few reasons for this, Sarah. The main reason being that people from a black and minority ethnic background suffer from underlying health conditions, and that's one of the major concerns that scientists and medics across the country have, is that people from South Asian backgrounds in particular suffer from type 2 diabetes and respiratory issues, heart conditions, and when they get into intensive care units with coronavirus, then they are in a lot of trouble because of those underlying health conditions. There's 2 other points as well, one being that a lot of them live in multi-generational households, crowded houses across the UK, and another one as well, that a lot of people from a black and minority ethnic background are key workers. They are working on the front line, either in the healthcare or out in transport sector or delivery drivers. A lot of people incredibly vulnerable to the virus, and that's why we are now seeing the government is going to take this review to see exactly why people from a black and minority ethnic background are disproportionately affected from COVID-19.